At 5, California nurses claim that the state is woefully ill-prepared to handle Ebola. They met with the governor today demanding higher standards. And they also held a rally in Oakland. That's where KPIX5's Ann Notarangelo is now. And Ann, did they get what they want?
Well, Alan, they are quite pleased with the reaction that they did get from Governor Brown. Even though they say they should have had the equipment and the training taken care of a long time ago, they now say help is on the way. Hundreds of nurses packed an Oakland meeting hall to tell Cal OSHA what needs to be done to prepare for an Ebola patient.
I have a hard time believing that there are enough hospitals in this state that can provide safe care to an Ebola patient.
Hours earlier, they left a meeting with Governor Brown in Sacramento after telling him the same thing.
I feel for the first time in ages kind of a small sense of hope.
Nurses say sitting at the same table with the governor and all the major players in California healthcare, they were able to make their case.
The nurses spoke of the issues that they were confronting in their hospitals, the dangers they see for themselves, the dangers they're carrying home to their families, and the dangers that they could present to patients themselves.
They say Brown gets the big picture, as well as the technical aspects of disease prevention, that they need more training and more equipment. Charles Idelson quoted the governor as saying,
"This is a top priority on my list. We're engaged. We're listening to the nurses. We are in action mode."
They want the governor to mandate hospitals follow the CDC's new recommended Ebola protocols. It sounds as if there's not a lot of faith in the hospitals.
You are absolutely right. There is not a lot of faith in our hospitals and our employers.
A national survey of nurses found 84% say they have not been given Ebola education where they can ask questions. Now, coming up at 6 o'clock, we'll hear from some of the nurses. They'll explain why they say their local hospitals are not prepared for an Ebola patient. In Oakland, Ann Notarangelo, KPIX5.
Homeland Security is tightening restrictions on air travelers entering the U.S. from Ebola-affected countries. So anyone coming from Liberia, Sierra Leone, or Guinea must travel through one of the 5 designated U.S. airports that are already screening for that disease. Travelers originally headed to other airports are going to have to rebook their flights. And we have just learned that the American photojournalist who contracted Ebola in Liberia is now free of the disease. And tomorrow he's going to be released from a hospital in Nebraska.